Sometimes your hips lie. Dr. Nicholas Mercer with uImproved PT. So a lot of times I will get a patient who comes in for kind of this lateral thigh pain that kind of starts from up here and comes down just like this. It's often diagnosed as IT band syndrome or trochanteric bursitis, which is to say, there's just some irritation on the tissues of the side of the hip. While those diagnoses would technically be accurate, it doesn't get down to the main cause of what is causing those syndromes, what is causing this pain, this irritation. And a lot of times it's simply some muscle spasm or trigger points in the side of the hip, and which is affected by some restrictions and potentially some spasms in the back of the hip and the front of the hip flexors and the hip extensors, or even the piriformis, which is a hip rotator. So when you have this irritation, a lot of times it's because the hip isn't working properly, and that's due to probably a lot of sitting, a lot of static posturing, and some weakness in some areas of the body. Everyone's a little different, but there's a few things we can do to help manage this pain, since a lot of it is coming from the spasm from the back, sides, and front of the hips. We can use soft tissue mobilization to help alleviate those muscles, alleviate those spasms, get some blood flow back, and restore the ability for those muscles to not only lengthen but also contract properly. So using whatever mobilization tool you have, I like to use a lacrosse ball. For some people that's a little too intense. They prefer to use a tennis ball to start out, and that's fine. Even a foam roller or massage gun is great. But any of those, just to get the blood flow back and reduce that spasm, will help alleviate some of the pain and the tension along the side of the leg there. So what you're going to do, simply lie on your back. We'll take that ball under here to the back of the hip, roll around until you find some sore spots, hang out there, try to relax those muscles. All right, and hanging out on those sore spots for a minute or so and trying to get those to relax, and then searching for another sore spot. And what you can actually do is make this continuous. So we'll start kind of in the back of the hip, and then as that starts to feel better, we'll readjust the ball, roll onto the side of the hip, which is sore on me. Find some sore spots in there. A lot of times that lateral hip pain is actually caused by radiating pain from trigger points in the tensor fascia lata or the gluteus medius. So we just want to search on the lateral hip here until we find a sore spot. Try to relax over it, almost like the lacrosse ball's here and the muscles melting over that lacrosse ball. Once that starts to ease up, gradually make your way over to the TFL, which is kind of where your front pocket would be on your hip. Get that to decrease, and especially with IT band syndrome, a lot of times what's actually the problem is these tiny muscle spasms, these trigger points in the tensor fascia lata that are actually pulling on the IT band. So it's not actually a problem in the IT band itself, it's a problem in the muscle that attaches to the IT band. So we're just going to try to break that spasm a little bit, and then as that starts to get better, we'll roll onto the front here and try to get some of those hip flexors, find that sore spot again, trying to melt over the ball there. All right, and again, this should take you anywhere from 5 to 10 minutes depending on how your hips feel. So do some soft tissue mobilization on yourself for these muscles in the back, sides, and front of the hips to help alleviate some of that lateral hip pain that you may get with activity, walking for a long time, or even sitting for a long time. And that should help some of the pain that you're having. Again, this is not a complete solution to your problem because everyone's different. Everyone has their own unique problems. Everyone's body's a little different. So if you want to start on your journey to finally ending this pain for good, go ahead and go to uimprovedpt.com. We have a lot of free information on ending hip pain, but we'd also love to have a free phone consultation or a free discovery visit with you to learn your specific story, what's going on with you, and what we can do to get you better as fast as possible with long-lasting results. So please contact us through uimprovedpt.com. We are looking forward to helping you improve your movement and improve your life.